Well, thank you so much to Felicia and to Anna and the other organizers for inviting me to come talk at this incredibly important symposium on obviously very important issues related to cancer. I am not a cancer researcher. I am, as was said before, I'm a political economist and my work is in health equity. That's the organizing theme for my lab. And so my talk actually hopefully won't overlap with a lot of the other presentations. I've been asked to focus on particularly the ethical issues that relate to this effort to integrate cancer, and especially cancer for women, and women's issues and women's health, with broader health systems issues at large. We see this very common in this area of public health research, health policy research. We've seen it with the work in HIV and AIDS, where there are disease-specific efforts that then, at some point in the advocacy and the research, move towards integration with the broader system of health, whether that be the social determinants of health outside of the health care system, the public health system, and then health policy, which broadly incorporates the health system at large. So I'm going to just identify a few key ethical issues that are relevant for the organization and systems that relate to health, public health and healthcare, primarily focusing on health policy. And then I'm also going to identify a few issues that relate to the ethics of global health and the global health enterprise and the different institutional structures that organize or oversee our work in global health. So just focusing on some of the ethical issues related to health systems. There are a number of issues, ethical issues that arise in the governance and management of health institutions and systems. There are different stakeholders, and again, they can be disease-specific stakeholders, groups that advocate for cancer versus groups that advocate for HIV and AIDS or other maternal and child health, as was discussed before. There can be different stakeholders based on gender, based on socioeconomic status. So when we integrate and think across and look for frameworks across an entire spectrum of health that would be encompassed through health equity, there are a number of different needs and values that are competing. And so that's one of the motivations for why ethical frameworks are helpful for thinking about this kind of integration. The reason is because ethical frameworks help us make decisions fairly. They help us understand what a fair decision is or is not. They help us understand whether different groups are being treated in the right way. And we even bring in rights and rights to health and other socioeconomic rights in this kind of a context. So one of the first issues we look at is allocating resources, and allocating resources across different health services and programs. So I'm really going to raise more questions than I'll answer, but the first question is, how should priorities be set? And how can we ensure that resources are allocated fairly and appropriately in meeting communities' health needs? So we need ethical frameworks to help us think through that. How much priority should be given to disease prevention as opposed to treatment? This is the kind of question that was brought up in previous presentations. And these kinds of questions and these kinds of frameworks and the systems that are set up to deal with decisions fairly should be set up in advance. Why? Because there should be a consensus around what the principles and guidelines are for making these decisions, so that health systems and different variety of problems and social problems that come up are not entirely reactive. And there's a systematic way of making these decisions and providing answers that people think are fair. The consensus, the commitment to the underlying values and the underlying goals are very important. The second set of issues around the ethics of health systems and public health relates to the funding and where the money comes from, and making sure that ethics is governing issues like conflict of interest, where funding sources derive their resources from, and what kinds of health institutions accept what kinds of support. In the medical research community, we're very commonly aware of conflicts of interest. Research that's supported by certain entities, pharmaceutical companies, for example, or different kinds of entities, even a foundation that may have a particular approach or agenda. How does that relate to the kind of work that's being done, and making sure that the work is done with integrity and is separate from any kind of interest that might be driving it? So these are very important questions. The other issue about funding is that the funding for health equity really has to come from a broad base through the population. It's the whole population at large. There are a number of different ways around the world that we fund health systems, taxation and other kinds of contributions, as opposed to a particular charity or a particular funder. Why? Because from an ethical perspective, a particular charity or individual donor isn't accountable to the public for health equity in a way that the funding source that comes from the population, comes from the people themselves, is accountable. Other issues in the ethics of health systems relate to access to care. This is very, very important. It was brought up in some of the previous conversations, but it's very important to recognize there are two dimensions to that, at least. The first is literal access, and there are lots of barriers to access that we find in the ethics of health systems. They could be geographic barriers. They could be socioeconomic barriers. They could be barriers based on discrimination in some form or another. So the barriers that occur when we access care are part of the ethics of a health system that we need to be mindful of. The other component is the quality of those services. So in some studies have shown that even deleterious outcomes can result from poor quality. So just access to kinds of services is not enough. It's the quality of those services and the actual impact they have on health outcomes, and for everyone, that the quality is equal across the population is very important in terms of equity and the ethics of health systems. Another set of issues relates to the tension between individual and population health. And this is very common in a lot of the disease-specific areas. So how much priority should be given to population health needs versus individual patient needs? And this is a tension that we have in this area. If not all needs can be met, how do we allocate resources? Are there broader goals that are set by society at large based on certain kinds of techniques like efficiency evaluation, cost effectiveness, for example, cost minimization analysis? Should procedures be set up based on involving the public in these kinds of decisions and having some consensus about what kinds of services should and shouldn't be covered, and these kinds of procedures? So setting up this kind of way of thinking about how to allocate resources when we're looking at the tension between individual and population health needs is very important. I also want to emphasize in this area of health systems ethics the focus on accountability. That's really quite central in thinking about the ethics of health systems. And so the question is, what obligations do health institutions and systems have to different communities that they are set up to serve? Are they serving these communities effectively? Who's keeping the institutions accountable? Who's watching? Who's monitoring? How does that monitoring occur? Is it through procedures set up through the population? Is it an administrative function? Holding these institutions accountable is incredibly important to make sure that we have the trust in the ability to achieve health equity when we integrate across different diseases. It's very, very important. And do the health resources that are being used, are they being used fairly? We are ensuring that corruption doesn't occur in our institutional frameworks. does the use of resources reflect our community values? And are the decisions being made fairly? These are all very important aspects of health systems. So just on this front, and then I'm going to turn to global health ethics, it's one of the important aspects and sort of functions of the work that ethical frameworks do is to also help balance when different values compete or in conflict. So for example, promoting equity was at the heart of what a health system should be doing from a normative perspective, but we also have scarce resources, so resources need to be used efficiently. And so how does a framework get set up where you're promoting equity and trying to reach every person and give them the conditions to be healthy, but we're doing that, the system's doing that in a cost-effective way, in using scarce resources as wisely as possible. We just saw the recent story about the EpiPen and how a necessary resource for people that literally saves lives has gone up in its cost to the population, its price to the population, by an enormous amount. And in fact, the leaders of that institution that provide that have been put forward to provide the reasons for why that kind of an escalation has occurred, because this is a life or death matter for people to have access to that life-saving technology. And lastly, on that front, it's important that there's a culture within these institutions when this integration occurs across the health system, that fairness and equity, that underlying value is in each and every procedure and process and decision that's made. So lastly, let me talk about a couple key ethical issues in global health. We were privy to presentations that talked about how many of the cases are occurring in many resource-poor settings, both within this country and also throughout the world. So it remains to be seen why there isn't more of a sense of outrage about this, that there's some sense that there's this inequity that's related to the social determinants of health, poverty, malnutrition, poor education, different living conditions, may be the responsibility of various international or global actors. So one way of thinking about ethics in terms of global health related to cancer and other conditions through an integrative approach towards health equity is to think about the current status of those unequal outcomes, those unequal accesses in terms of the system as a collective failure on the part of the international community to meet the most basic needs that individuals across the globe have. And so that kind of framing of the issue puts forward an urgency that this is an urgent challenge with respect to global health ethics to specify the actions of the global architecture, the global health community, the different institutions, whether they be foundations, the World Health Organization, the World Bank, all these different parts of what we call the global health architecture, but also wealthier countries and wealthier communities within countries, that they should take this as a matter of justice and solidarity to promote equity at the global level. I'll stop there. Thanks.